disorders are like malnutrition, vitamin A deficiency, anemia. There are also non-communicable diseases, water-related diseases, and other issues. Prenatal health of mothers. In Nigeria, prenatal health of mothers is considered very major. Challenges: limited access to healthcare, cultural and socio-economic factors, inadequate care, limited health education. Results: maternal mortality ratio 576, deaths divided by 100,000 live births. Infant mortality rate 69 deaths divided by 1,000 live births. Under 5 mortality rate 128 deaths divided by births. Antenatal care coverage 61.4% and skilled birth attendance 43.5%. Risks: teenage pregnancy, multiple pregnancies, HIV, AIDS, malaria, hypertension, malnutrition. Recommendations: delay marriage until 18 plus age, prevent malaria and infections, manage diabetes and hypertension. Infant mortality rate in Nigeria is 67 deaths per 1,000 live births. Birth rate: approximately 37.6 births per 1,000 people, and the death rate is approximately 12.4 deaths per 1,000 people. Nutrition. Nutrition is a major problem in Nigeria, like undernutrition, malnutrition, overnutrition, and rising obesity, food insecurity, and access to nutrition. To fix this, we can give access to nutritious foods, make them aware of nutrition, improve water and sanitation, improve maternal and child nutrition, etc.
The health conditions of South Africa. South Africa face a burden of diseases and health conditions like HIV, AIDS, asthma, etc. The some major ones amongst them are tuberculosis, diabetes, HIV, AIDS, pneumonia, and influenza. The parental health of mothers. Parental health of mothers in South Africa is a large challenge as maternal health depends on the mentality of the child. Some issues leading to this are no access to health care from people of different economic backgrounds, public versus private health cares, maternal mortality rate, HIV, AIDS, nutrition, health education, teenage pregnancy, mental health, etc. Nutrition in South Africa is a complex issue based on economic backgrounds, food insecurity, and more. Some prominent key issues are undernutrition and micronutrition deficiencies, overnutrition and obesity, food insecurity and poverty, infant and child feeding, and climate change. The infertility rate, which is IMR in South Africa, has seen significant changes over the past few decades, but it is still a major health concern. It refers to the number of infants who have died before their first birth per 1,000 live births. In the early 20s, 50 deaths per 1,000 live births. In 2022, 28 deaths per 1,000 live births. This shows the birth rate in Africa has been steadily improved by access to improved health care. In 2023, 20.5 birth rates per 1,000 people. The death rate in South Africa refers to the number of deaths per 1,000 people. In 2023, 9.5 death rates per 1,000 people. Thank you.
Very nice research work done by both of you, especially Aranya, and presented that the ratio of infant mortality rate and birth rate and what are the problems that is being faced by these two countries in terms of prenatal health of the mother and the common diseases and nutritional defects. So there are many, diseases that we found to be common in both the countries. Yes or no? So now
Yes, sir.
let us find out, yeah, the other two countries are point of research, that is India and Sri Lanka, whether what we have experienced or seen in the case of Nigeria as well as in South Africa, whether the same kind of problem we are facing in India as well as in Sri Lanka, or it is slightly different. So please be ready with the second presentation. Yes, Ishi?
No, ma'am, I was just sharing the presentation.
Perfect, perfect. Please go ahead.
Health conditions of India and Sri Lanka. India. India faces many challenges against health problems and infectious diseases. Some prominent examples are of non-communicable diseases, malnutrition, prenatal health, and maternal plus child health. Let us observe some major conditions. 10 common communicable diseases include tuberculosis, influenza, hepatitis B, malaria, measles, HIV, AIDS, cholera, dengue, rabies, and COVID-19. These diseases spread through various means such as air, water, direct contact, and vectors like mosquitoes. The primary non-communicable diseases, or NCD, in India encompass cardiovascular diseases, chronic respiratory diseases, cancers, and diabetes. These diseases collectively represents the majority of NCD-related morbidity and mortality in the country. The birth rate for India in 2024 is 16.750 births per 100 people and a 1.17% decline from 2023. Prenatal health of mothers. In India, the prenatal health of mothers is considered very important. Challenges. Several challenges constrain maternal and reproductive health in India. Three important ones have been discussed: spatial inequity, the diverse underlying casualties, and the quality of care. Results. A study shows that only 40.3% of the women receiving antenatal care in the North reported having their blood pressure measured during antenatal visits compared to 87.4% in the South. Through the DLHS3 data indicate that these differentials persist, they present a greater cause for concern. Risks. Stillbirth and early neonatal death are two major risk factors responsible for poor perinatal health in India's scheduled tribes. These adverse outcomes of pregnancy are preventable by adequate antenatal care and childbirth in hospitals. Recommendations. All pregnant women need to be given one tablet of IFA, 100 milligrams elemental iron, and 0.5 milligram folic acid every day for at least 100 days. This is the prophylactic dose of IFA. If a woman is anemic, give her 2 tablets of IFA per day for 3 months. Nutrition. Approximately 14% of India's population is undernourished. Between 15 and 49 years old, 51.4% of women are anemic. The report finds that 34.7% of children under 5 are stunted and around 20% have wasted.
Sri Lanka. Health conditions. Sri Lanka faces a burden of diseases.
Anna, you may open.
HIV, AIDS, asthma, mental problems, hypertension, diabetes, cancer, and maternal and child mortality. Some major ones are tuberculosis, diabetes, HIV, AIDS, car- cardiovascular diseases, pneumonia, and influenza. Prenatal health of mother. In Sri Lanka, the prenatal health of mothers is considered very important. Challenges: high blood pressure, gestational diabetes, infections, preeclampsia, preterm labor, pregnancy, loss, miscarriage, stillbirth. Women who do not receive prenatal care are also 3 to 4 times more likely to die from pregnancy related complications than those who do receive care. Results: depression and anxiety, high blood pressure are a few of the results. Risks: babies of mothers who do not get prenatal care are 3 times more likely to have a low birth weight and 5 times more likely to die than those born to mothers who do not get care. Doctors can spot health problems early when they see mothers regularly. This allows doctors to treat them early. Recommendations: consume foods and beverages rich in folate, iron, calcium, and protein. Talk with your healthcare professional about prenatal supplements, vitamins you may take while pregnant. Eat breakfast every day. Eat foods high in fiber and drink fluids, particularly water, to avoid constipation. Nutrition. Sri Lanka faces a double burden of malnutrition with the coexistence and persistence of multiple forms of malnutrition. Examples: stunting, wasting, underweight, overweight, obesity, anemia, and micronutrient deficiencies.
Thank you so much, Eshi, for what the wonderful slide and research, and of course, supplemented by the two presenters. Now we will move on to Anika. She will summarize the common pointers between the countries that we have just shared, the problems and issues. Yes?
Mom, Cheryl and Dia are supposed to.
Cheryl, okay, fine. Cheryl and Dia, please move ahead with your presentation, then we will do the summary. After we have the presentation of Cedar Hall Academy, Mr. Madhu, after this presentation, you can ask your children to present. Then we will have the summary part done by our children.
India and Sri Lanka health conditions.
Overview. You can continue.
Health, nutrition, and well-being of in this presentation, we will cover health, nutrition, and well-being of infants, prenatal health of mothers, birth rate, which is the number of live births per thousand of population per year, and death rate.
India. Dia, can you unmute?
Yes.
Dia, can you unmute?
Yes. Health and nutrition and well-being of infants in India.
I'm saying you have to unmute yourself. I mean, you have to unmute yourself.
Oh.
India. Health, nutrition, and well-being of infants. Safe and nutritious food is the basic essence of human survival, growth, and development, especially for infants and young children. In India, the situation is concerning, with many preschool children suffering from stunting and wasting. Some reasons are chronic undernutrition, maternal health and education. Children of young, underweight, and uneducated mothers are at a higher risk of stunting and socioeconomic factors. Birth rate. The birth rate for India in 2023 was 16.949 births per 1,000 people. Death rate 27.695 deaths per 1,000 live births. Infant mortality rate probability of dying between birth and 1 year of age expressed per 1,000 live births.
Prenatal health of mothers in India. India has 705 scheduled tribes with a population of 104 million people, constituting 8.6% of the total population. These scheduled tribes predominantly reside in rural areas with low literacy rates, poverty, and inadequate access to public health services, which makes them vulnerable and makes them have poor health indicators. The major complications that account for nearly 2/3 of all maternal deaths are severe bleeding, infections, high blood pressure during pregnancy, complications from delivery, and unsafe abortions.
Sri Lanka. Health, nutrition, and well-being of infants. In Sri Lanka, almost 1 in 6 babies is born with low birth weight. These infants are at a disadvantage for growth and physical and cognitive development. Despite relatively favorable indicators on complementary feeding, the prevalence of wasting is at critical levels. Birth rate 14.391 births per 1,000 people. Death rate 6.282 deaths per 1,000 live births. Infant mortality rate 6.438 deaths per 1,000 live births.
Prenatal health of mothers in Sri Lanka. Healthcare in Sri Lanka is mainly provided by practitioners of Western medicine. The majority of services are provided free of charge by the government, and the state health system provides 50% of medical treatment, 95% of hospital admissions, and 99% of preventive care. Lack of awareness regarding maternal mental health problem among grassroots level healthcare workers, poor integration of services, and the culture and stigma regarding prenatal mental disorders are barriers to improving services in maternal healthcare in Sri Lanka. Thank you.
Thank you.
Thank you so much, grandchild. That was a nice summarizing of the problem being faced in Sri Lanka and India. Mr. Madhu, would you like your students to present? And then we will have the summarizing done by Anika and Advika from our end, and maybe your students can also find the common pointers to take a note of. Mr. Madhu, your mic is off.
Oh, can you hear me?
Yeah, I can hear you.
Okay, I think we are ready. David is ready for his own presentation. I think we are going to start with David.
Wonderful.
David's poster.
Okay. Please go ahead. Anika and Advika, you be ready. In the end, we will have the summarization. Okay?
Yes, ma'am. Yes, ma'am.
Aradhyan, sorry. I took Advika's name. Yes, Mr. Stephen. Mr. Man. Okay.
You can start. David, you're on. So unmute yourself, please. Start.
Good day, everyone. This is the presentation of Nigeria and South Africa.
Hello?
Yeah.
You lost your connection. Okay, please, he's lost his connection. He's coming back.
Okay, okay. We are waiting. No worries.
David, can you?
Yeah, take your time. Take your time. Again, issue with your network?
David, are you back? Yeah, we have issues with our network, but I think it's a bit back. It's coming back. Whoa. Okay, you can start. I think you are on. Okay, maybe you can start.
Okay.
You can start, you are on.
Okay.
Someone should move this up. And Mike. Kindly your mind. Okay, you can start, David. David, unmute yourself.
I've unmuted myself.
Mr. Monica, which line is presenting? Please let David.
Mr. Madhu, are we having any issues here for presentation? You can probably click on resume or go to slide show, and then we can do the presentation. Or if you want us to present, we will present. You can share the link.
It's like a PowerPoint.
The mic of your system.
Yeah, it's working. It's not allowing me to, like, when I do this. When I open the slide, it will still be here.
If you can share the PPT link with us, maybe we can present and you can speak on it. If you wish.
This is the...
Emanuela, please, can you start once David's seems that David is having issues?
Okay.
It's like...
Emanuela, please, can you
If
come
I'm
on?
opening the slide, it will still be on the page to edit it.
Please, can you start your screen sharing and then you start?
So are you sharing the slide? Should we present on your behalf and you can speak on it, the information?
This one's to share the...
If you share it, there's a problem.
Like what? No, the voice is okay. I think the voice is okay. It's strange. I think his internet that's the problem.
David, wait, let me manage.
I've stopped. I pressed.
Mr. Madhu, but is there any issue with the presentation?
Yeah, Manuela is presenting, please. And yeah, please just bear with us a bit. We are having network challenges.
Okay. So we got the PPT on screen. Maybe your students can speak on it.
Manuela, can you start? Are you on? Okay, you can start. Kindly unmute your mic. You can unmute your mic and start. We're waiting for you, Manuela. Okay.
Mr. Madhu, is it too much of a problem to present? Then probably we can hold another session for the same.
Emanuela, we can see your screen. Can you start your presentation? Can you introduce yourself? And we can't even hear you. Mic is off.
Yes. We can, Mr. Madhu, we can see your presentation. If you have any issues or glitches, do let us know. We may schedule another session for your students to present.
Hello, I can't get you. Can you please come again?
Because there is too much, noise coming from your end.
Hello?
And your screen is also frozen.
Hello? Hello? I can't get you.
Yes, Mr. Madhu, can you?
Hello, Miss Namita?
I'm listening.
Hello, Miss Namita?
I'm listening. I am listening, Mr. Madhu. Please tell me, or you may type in the chat box.
Hello?
Mr. Madhu and yeah, thank you so much for joining. Dear students, they could join only 2 students from this school, and the problem is they are having major network issue. So I guess we'll have to call it a day today, and we will be holding another session with them in which the students of Nigeria, they will present their findings. We'll soon schedule it, and I will let everyone know the details of our next meeting. Okay? And in the meanwhile,
Okay, that one will be better.
Advika, yeah, because I think we're holding for too long. If it is coming back, the network is proper, then you can present, or otherwise we can have a small or short presentation some other day. So whatever is possible, do let me know now, Mr. Stephen, so that I can tell the students to either leave or stay back, depending on what you are planning to do now. Have you been able to fix your network? If not, then let's plan it for another day. It will be shorter because obviously our side of the presentation has been done. So maybe we'll be holding a meeting for just, half an hour or so for your presentation, and then culmination by picking up common points. Is that okay with you?
Okay, can you hear me now?
Yeah.
Hello, can you hear me?
I can hear you.
Yeah, it seems that that's what we're doing. It seems that that's what we'll do because we are having challenges with our network connection now. So maybe we can just shift it to another day, probably next week. But before then, I'll just get in touch with you.
Okay, no worries. No worries.
About 2 or 3.
Okay, no worries. Take your time. Do let me know when your connection stabilizes so that we can fix up another meeting. Okay?
Okay. Thank you so much.
Okay. Thank you, children, for being there online and being a part of the research and information shared. We'll meet again once, as they said, they are having major network issues. So once they're able to stabilize the connection, we will have meet and listen to their side of the story. Okay? See you then. Bye-bye, everyone.
Bye, Mom. Have a nice day.
Bye-bye.
Bye, Mom.
Bye-bye.